for worksite health promotion. And I would like to welcome you today in the third of our webinar series on the best or the healthiest workplaces in the world. And I think many of you are familiar with or know the Global Healthy Workplace Awards, the slide that you can see now, which basically has produced or has showcased the winners that we have had in the webinars in the last three series. And we're very glad today to welcome the winner of the multinational enterprise category, which is IBM. And I'll introduce our speaker in a little while. What I wanted to do first, I would like to give you an overview of what the awards are really all about and what they're based on, what the criteria are. I think this is especially timely as we're just about to enter our third year of the awards program, and applications are welcome in beginning of January, and the application period will go to the end of February. So any enterprise, any organization, whether it's for-profit, non-for-profit, small, large, industry, service, you name it, are eligible to apply for this award. There are a few things that they should have in place in order to apply, and I'll mention these as we go along. So the Global Center for Healthy Workplaces is a relatively new organization which is basically founded coming out of the Global Healthy Workplace Awards. The interest has grown, and this is a truly global initiative. We have applications and inquiries and so on from really every continent of the world, which is very exciting. And the Global Center is responding to that, so it will go beyond the awards program to provide additional resources in terms of training, also accreditation, and the like. The organizations behind this one is my company, which is called International Health Consulting, and my business partner is iGenius, which is a world community of social entrepreneurs with members in over 200 countries. Based in London, the UK. And as you can see, I think we have a fairly powerful advisory board, and also as we kind of roll out services, these organizations are really involved in one form or another in terms of providing these. First of all, of course, the International Association for Worksite Health Promotion, IAWHP, really the only global association for practitioners in our field. And we are growing our membership globally. We have a big membership base, of course, in the US, but also in Brazil, and growing as we go along. So it's an exciting process. So I'll encourage you to check out the website if you haven't done so, which is iawhp.org. Now, a couple other organizations here. The International Organization of Employers, great network. It's really the umbrella organization of all national employer federations. So basically, all kinds of enterprises which are a member of their national federation will be represented here in the IOE, based in Geneva. The International Institute for Health Promotion at American University in Washington, D.C. has been around for a long time. Very, very strong network of organizations, a lot of academic institutions, but not only, who are interested in promoting health, not just at the workplace, but really in a proactive manner in terms of health promotion, well-being, and prevention. The European Network for Workplace Health Promotion, the ENWHP, has also been around since the mid-90s and has provided multiple resources in terms of promoting health at the workplace in Europe with all the European member countries and affiliates. So again, I encourage you, for those of you who work in Europe or have employees there, to look at their website. There's a bunch of resources as well. I think for those of you in the US, many of you probably know the Health Enhancement Research Organization, or better known as HERO. A very reputable organization, started out as a research organization, as the name says, but now really gone into how to apply research to the more practical level, also with some great committees, position papers, very, very powerful organization as well. Then we have People in Aid, and this organization is focused on the NGO sector and how the employees of NGOs, especially those in crisis areas, how is their health being taken care of? So they bring in a different perspective, which is very interesting. And then the last one, this should actually say Concern Worldwide. This is still an old version, also working in the NGO sector. So I think we have a pretty broad advisory board to make sure that we're really, pushing health with regard to the workplace and employees globally, worldwide. The second slide here really shows the World Health Organization Healthy Workplace Framework, or Model for Action, as it's also known. I put this up because the entire awards program, the criteria, are based on this model. Now, I should say, and I can show you the next slide. I'll go back to this slide in a second. This is a disclaimer. You don't need to read it all. I have to show it because the WHO is not officially endorsing this awards program. It's a policy where private organizations or enterprises are recognized. They will not, put their logo or officially endorse the initiative. So just so you know that, and I don't get into trouble. Okay, but nevertheless, we believe that this approach, the framework, is global. It's applicable globally, and it's universally relevant, we think. It is complex, as you can see. I think they did a fairly good job with the graph, trying to put something into a graph which is fairly complex. So just quickly, there's 4 main areas: physical work environment, personal health resources, the psychosocial work environment, and the enterprise community involvement. So as you can see, it's not just about complying by legislation, making sure that the workplaces that companies are offering are safe in terms of air and noise and so on, ergonomics, but also the psychosocial work environment. So, in terms of the relationships between people and the stress that can originate out of a workplace, how is that handled by the company? Personal health resources really gets into some of the more wellness type programs, I would say, looking at lifestyle, nutrition, fitness, those kinds of things. What are companies offering in that area? And then enterprise community involvement is really, in a larger sense, what does the company do in terms of their immediate community? And you can define communities in different ways, but beyond the actual workplace and their own workers, are they having an impact? Maybe dependents and so on. So that's another one which we believe is important, and where the employer can have such a meaningful impact, especially in emerging countries, I think. The center, you will see the blue squares is the continual improvement cycle. I won't go into that into detail. I think most of you are aware of that. I do want to point out, however, very important, the assessment and the evaluation components. Still a lack. I see still a big lack globally, and the global survey from Buck Consultants every other year shows that. They show that only half, a little more than half of those respondents evaluate specific outcomes or measure specific outcomes in the programs, which is unfortunate. We all know how important that is. You need to evaluate. You need to find out, why is your program doing well or not so well? How can you adjust? What do you need to do? So very important. And then if you go right to the center, of course, ethics and values. Does the enterprise comply by legislation? Those things, and then of course leadership engagement and worker involvement. We both know how important that is, from the very top to the middle to the bottom, to get input, to get support, visible, active support, to make a program successful. So very important as well. And then in the bottom left, as you can see, there's 2 added factors which are not directly in the WHO model, which is innovation and replication. And innovation is always highly regarded or rewarded, I should say, in this awards program. And so if companies make that clear and document it, they get a higher score. And replication basically is that the programs, parts of the programs, should be able to, that other companies should be able to learn from it, and ideally maybe replicate parts of it. So it's not just a standalone, nice to see, but the rest of the world can't really do anything with it. So that's another important factor, and that the applicants have to show that, and document it. So that was really just a very quick overview of the WHO model. Excuse me. So this is my last slide before I hand over to Dr. Balaji here. So this was the last 2 years, as you can see, the winners and runner-ups, and the exciting part really is that I think, at least, that we invite 2 finalists per category. So there's a small and medium-sized enterprise category, employers up to 500 employees, a large enterprise category, which is basically any type of enterprise above 500 employees, but within one country or one site. And then we have the multinationals, which face different challenges because they offer programs all over the world, as you will hear. So we invite 2 finalists for each category. They come to the site. It will be next year, as you can see here, in Brazil, in Florianopolis. And they make their case. I mean, they have already been evaluated. There's a pre-evaluation by the judges, and we have 5 judges that from 5 different continents, all authorities in the field. And but the final push basically is being made on site, presentation, and then the judges have the chance to ask questions right there, probing questions, if you will. So it's a very exciting process, and so they come there. They don't know if they're going to win. Of course they want to win, but all of the programs are excellent. So I always tell them, nobody's a loser, because the reason you're here, you have an excellent program. So, but nevertheless, of course, you want to win the category. And this year, 2014, we had a global summit in Shanghai, in China, and the multinational enterprise category, IBM won, just barely beating out Unilever, which is also a very well-known company with an excellent program. And at this point, again, I'd like to congratulate IBM for it, and Dr. Balaji Lakshmipuram, who was there, who presented with his colleague from China, did an excellent job. I'm going to hand over to you now. I think this is a good segue. Let me just introduce you. Dr. Balaji is the global health promotion specialist and the Asia Pacific lead for health promotion at IBM Integrated Health Services. And as you will see, they have a very global approach and global team to doing this. So I'm going to hand over to you, Dr. Balaji, and I will drive the slides. So just let me know when to change them. Thanks.
Yeah, sure. Thanks, Wolf, for the introduction. We move on to slide 5. So IBM has branded the entire wellness and health promotion as Commit to Health. And we want to ensure that this brand of Commit to Health is quite popular among the employees, the managers, the leaders, and everyone at IBM, so that we can really drive health promotion and wellness across IBMers. Moving on to slide 6. This reflects the IBM leadership around the world. And as Wolf rightly pointed out earlier, innovation is the key word here. Innovation starting from extreme west of the globe, going to the extreme east of the globe. There are a whole lot of innovations which really cater to the local needs and which are very much accultured to the local needs. For example, on this slide, you can see here innovations like financial incentives for healthy living, or even the IBM Baby program, which provides support to new mothers in Brazil. And as we move across the globe towards Japan, we see successful smoking cessation and stress reduction innovations, and even in ASEAN, where it's more of social events for physical activity and wellness. That is more of a gamification approach of wellness. So this overall reflects the huge commitment that our leadership has towards employee health. Moving on to slide 7. This is a broad vision and mission. The vision is around the keywords performance, healthy choices, and with 4 important stakeholders, namely people, workplaces, families, and of course our communities. The mission, it's mainly around addressing a combination of local and global health priorities, improving overall health of our employees, and most important, supporting business continuity along with provision of a very safe and healthy work environment. This is a very broad mission, which of course is done through improving access, improving quality, innovation, and costs, reducing costs, of course. This is a broad mission that we have. Moving on to slide 8. As Wolf earlier pointed out, this is a broad WHO model, and we have gone slightly even beyond this model, encompassing physical work environment, personal health resources, enterprise community involvement, and psychosocial work environment. In addition, there is a constant PDCA cycle, the plan, do, check, act cycle, which here is very much translated in the form of planning, implementation, and operation, followed by checking and management review. And the core of all this is guided with the corporate policy. And IBM has very clearly got 4 important pillars. You can see that on the right-hand top corner of the slide, slide 8, right-hand top corner, where you can see the health promotion, safety, health benefits, and the medical pillars. We'll talk more about them in the subsequent slides. But on the whole, it definitely embraces the WHO model and ensures that we really cover every aspect of employee well-being. Moving on to slide 9. These are the top global priorities, as we call them, across the different pillars. As I said in the previous slide, we categorize them into safety, medical, health benefits, and health promotion. And health promotion itself has got around 10 priorities. Because we are reworking on this to see if we can really combine a few of them and if there's really a more of interlock between the priorities. In the health promotion, we believe in starting with an assessment, health risk assessment, popularly called the HRA across the globe. And we have our own global vendor who delivers the health risk assessment across different countries with a broad common health risk assessment, but very much accultured to suit the local needs. And the other important priorities in health promotion include active living, healthy eating, sleep and rest. In fact, IBM has been one of the pioneers to talk about sleep and rest as a part of health promotion. And of course, emotional well-being, which most companies do offer, preventing tobacco, alcohol, and drug abuse. And this will be very relevant in specific parts of the world, and also in parts of the world where a lot of young employees are accustomed to tobacco, alcohol, and drug abuse. And the other important things are injury and violence-free living, infection and clinical prevention. And of course, the base of the entire thing is engagement strategy. Strong engagement strategy, we really desire to drive all of these priorities within the health promotion. In addition to these 4 pillars of safety, medical, health benefits, and health promotion, we do have a whole lot of foundational principles where there's a lot of leadership commitment. And these foundational principles include leadership and public policy influences, talent, and partnerships. It could be internal and external partnerships with known resources as well as with authentic publication. So on the whole, it is a combination or an integrated strategy which really drives health promotion. Moving on to slide 10. In slide 10, we have highlighted the strategic approach to health promotion advancement. Now, it all begins with a framework. Framework for global direction, framework for processes, framework for measurement, and most important, framework for local innovation and prioritization. Because unless and until there is a local innovation or prioritization, the programs would not be really all that effective or driven through. And this very much is scalable with cross-border programs, and they do have shared central and local investment. And the most important, which is highlighted in red, is the local partnerships. The local partnerships is the most important to address the local health needs and to deliver the high-touch services. Because unless and until the local partnerships are strong, the services may not be perceived as high-touch by the employees across different countries. And these definitely supplement the global program. This is a broad strategic approach to our commit to health. Moving on to slide 11. This is our teaming approach. We have a health promotion pillar owner with a core global team, and these core global team members are scattered across the regions, in the Asia Pacific, India, that is Europe, Middle East and Africa, and Americas. Then we have the global priorities, which I mentioned in one of the previous slides. And each of these global priorities have subject matter experts and teams working with the subject matter experts on the global priorities. And many a times we partner with external vendors or even with highly authentic external resources to support with the subject matter experts on various global priorities. And of course, the most important, the bulk and the base of this entire pyramid would be the local and regional leads who help operationalize the design that flows down. And you can see the arrows here are bidirectional in the sense that the inputs goes from the local regional leads right up to the health promotion pillar, as well as downwards from the health promotion pillar down to the local leads. So this bidirectional arrows really ensure that the inputs at all levels are incorporated, analyzed, and then it is designed and operationalized, as opposed to just being a unidirectional arrow. Moving on to slide 12. This is a strong basis for our health promotion. We begin with health assessment and screening. As an outcome of health assessment and screening, we have two things. One, health education and awareness, and we'll have a whole lot of programs and policies around this. And two, we call them the high-touch, high-tech programs. Later in the slides, I'll show you some examples of our high-touch, high-tech programs. We call them as targeted support programs. So these two together would really be the basis as an outcome, basis for health promotion as an outcome of initial health assessment and screening. Now these are driven by innovative engagement strategies, and as Will rightly pointed out in the earlier slide, innovation, replication are two important things which though not clearly specified in the WHO model, definitely they are a basis for stronger health foundation across the globe. And these are supported by various healthy worksite environments. Moving on to slide 13. This is a snapshot of our global health risk assessment and surveillance. We have a vendor based out of Canada who supports globally. And this assessment, there's assessment, feedback, and triage to follow programs. It is translated and it is aligned very much to the local country needs, although the broad framework of health risk assessment is quite common. And we have specific dashboards on key metrics. These are both country-level dashboards and global data dashboards. They address almost all types of health and lifestyle risks. And they are even categorized to support business leaders, managers, HR leaders, apart from individual employee self-dashboard, which only the employees would have access and nobody else. And at all stages, we maintain utmost confidentiality and data privacy. Moving on to the next slide, slide 14. This is a typical example of high-tech, high-touch program that we explained earlier, a virtual health fair and online health community. This is basically a virtual global health event, and we had live presentations from 20 experts around the world. We made sure that we have experts representing different parts of the globe, right from Americas in the west to Japan in the east, and there's a lot of interactive booths. And these interactive booths gave an opportunity for Q&A, question and answers with the experts. And the presentations and materials were in 8 different languages. And employee exchange and sharing were through online community. It's called as the Online Commit Health Community. We covered a whole range of topics on this, and some of them were very much needed for the local countries, whether it could be around driving safety or infection prevention, or even know your numbers as a part of clinical prevention. There were a whole lot of topics covered in this virtual health fair. And this was a very innovative way to reach IBMs across the globe within a short period of time. Moving on to slide 15. This is popularly called as a wellness advisor. It's basically an integrated support to health. So this wellness advisor is a telephonic program. It has got 3 broad components: medical support, behavioral support, and wellness support. We believe that unless and until these 3 are integrated, we would not really be able to offer integrated healthy approach to our employees. The medical support, once again, could be anything. It could be from having a medical line. It could just be a symptom self-check, or even some information around medications or vaccinations, and most important, pregnancy support. Pregnancy support mainly part of healthy habits during pregnancy as a part of antenatal care and prenatal visit planning, and most important, prevention of postpartum depression. All this is being taken care. And it could also be frequent decision supports, like asking about second opinions, or the options for common ailments, like it could be options for a back pain or any other simple ailment. And the most important being condition management. Condition management, the common conditions worldwide are diabetes, high blood pressure, hepatitis B, heart disease, and high cholesterol and arthritis. So these are all parts of the medical support. But in addition to the medical support, we have behavioral support. So this, to begin with, is the EAP services, the Employee Assistance Program, wherein various topics are covered, like stress management, relationship issues, especially the younger generations. As we move towards the younger generation, relationship issues are found to be a big problem. And also it covers the manager assistance in case workplace assistance is needed, and critical incident support. And one of the things that is a market differentiator in our EAP services is financial and legal advice. While most EAPs offer all other things, this financial and legal advisor is definitely addition to our EAP service, because it has been found through various researchers and also through various publications from World Health Organizations and other renowned organizations that there's always some amount of financial implication in most of the self-harm cases. They say the paper quotes that almost 70% of self-harm cases across the globe in the general population has some underlying financial implication. Although the financial implication may be buried underneath, and the tip of the iceberg may be some other problem like a relationship issue or some other issue. But when we dig deep into the iceberg, a financial issue has always been a cause for concern among the self-harm cases. So financial and legal advice as an addition to EAP service is definitely a market differentiator for IBM. The other important line in Wellness Advisor is our wellness support. We call this as the wellness coaching. Now, having identified the various health risks through health risk assessment, it is important to ensure that employees have access to various measures to curtail this risk, or we need to have access to resources to mitigate the risk. The three important things are the sedentary habits, unhealthy eating, and smoking. Worldwide, according to WHO websites, these three really figure in the top causes of health risks among employees, although the exact ranking may vary from country to country. And targeting this, we have the wellness coaching around weight management, around smoking cessation, physical fitness. And in addition, we've also provided wellness coaching around sleep and cholesterol management, or even overall developing and maintaining good or healthy habits. So this wellness coaching has been a very important component, and this really links the health risk assessment to an intervention module. So it's actually a link between the employees getting identified themselves with various risks and to the point where they're ready to undergo change, or where they're ready to really deploy some intervention program to really see the change. So this in broad is our Wellness Advisor program, which is an integrated support for health. And last year we did pilot this in Brazil, India, and Austria, and more countries to follow in the coming year. This once again is being delivered by a global vendor, but the global vendor partners with the local vendors across different countries so that they are sure of the local acculturation, the local language, the local customs, especially when it comes to counseling and wellness coaching. Definitely the local dietary habits, the local customs are taken into consideration. And we have ensured that we get a good data because the global vendor is involved in this in partnership with multiple local vendors. And the data that we get is uniform and it's of high quality. So that's the advantage of having a global vendor with excellent local partnerships and creating the programs in a bi-directional way so that we have good high quality data, but at the same time very well accepted by the IBMers across different countries. Moving on to slide 16. This is another innovative thing that we have done, that is mental well-being support training for HR and managers. Most times, or most often, we have found that the early signs of stress among employees, or sometimes even early signs of stress among managers themselves, are often ignored, or in the sense they are not perceived in true sense as stress. So as an effort to really come out of this stigma, we have the mental well-being support training. It's an on-site training for human resource partners and for managers, which really helps them to identify early signs of stress. And it's not just about identifying early signs of stress, but also to respond to such cases in a highly confidential manner, and also to respond to substance abuse issues at different on different occasions. And most important, we leverage on this training to promote awareness and utilization of employee assistance program. And one of the things that has been studied across the globe, this is in fact quoted in a paper from UNICEF. It talks more about stress in children, but they have quoted about EAP, where they say just the presence of EAP over a period of time will not be enough unless and until there is a constant drive, constant awareness about EAP. So we have leveraged on the mental well-being support training program to promote awareness and utilization of the EAP, so that managers and HR partners know whom to reach out, where to reach out, what numbers to call in if there is a need to do so. The most important or the core component of this training is destigmatization of mental illness. We no longer want to call them as mental illnesses. That's because we call them as well-being. It's a part of the well-being and resilience management, or managing stress. So this destigmatization is really a key component of this training program. And we've been quite bold to talk about the prevention of self-harm, or as they call prevent suicides, through early recognition or referral and interventions. And the most important, as an outcome of this training, the HR partners and the managers would know what are all the steps to follow, or what are all the clear steps to follow in case of a crisis situation. So this is both virtual as well as on-site training program, and the recording is there virtually so that managers or HR partners can go through that in case they didn't attend the on-site program, or in case they want a refresher training. So this is another important component of emotional well-being. Moving on to slide 17. So while we talked about various components like personal health, physical health, emotional health, there's also a lot of published health improvement and cost savings, like effectiveness of incentive-based online physical activity intervention in the employee health system, or it could be internet-based worksite smoking cessation program. All these have been published, and this is just a snapshot of some of the publications. Moving on to slide 18. This is an example shared here, a longitudinal impact on healthcare costs. It's IBM US healthcare cost, claims cost trends based on the number of years employees completed healthy living programs. So here we find the zero year or the non-participant is represented by a red line, while the blue line represents those with minimum participation, 1 to 2 years, while the highest one is the green line with those with more than 9 years participation. We can very clearly see that the annual increase in the cost is definitely lowering down as the years of participation increases in the healthy living program. So this is just an example being shared here to show the return of investment, in addition to the whole lot of value of investment. As we know now, in the last HERO conference, Health Enhancement Research Organization conference, was clearly emphasized that we gradually need to consider more of VOI, value of investment, as opposed to earlier concept of just ROI, return of investment. Moving on to next slide, slide 19. This is another component which we saw in the earlier WHO model that Will shared, community enterprise involvement. So we have supported a whole lot of community, and it is beyond the purview to share them in a slide, but just captured a few of them. It could just be run with the Cancer Research Institute in Vietnam, or it could be patient-centered primary care collaborative, or support with GBGH, and there is Global Business Group on Health, or in Children's Cancer Institute in Australia. So just some snapshots shared here, and there are a whole lot of other things which are not shared here, but very much a part of community enterprise involvement as a part of the WHO model. So to summarize, we have covered all the components of the WHO model: the physical component, the personal health component, the emotional component, the community enterprise involvement, and the most important, innovation and application. And all these are definitely a part of our PDCA cycle, and it is a continuous ongoing process. So that's it. Thank you very much, and I'm open to any questions.
Thank you, Dr. Balaji, for the excellent overview. Very rich program. I'd like to ask the audience or participants to type in your questions in the question box, and I'm going to ask Heather to help me to find those or read them out. Let me start with a first question now. Give people a chance to type them in. What about Dr. Balaji? You're based in Bangalore, India, correct?
Yeah, that's right.
Yeah. I was going to ask, what about, just to give a kind of a local snapshot, what are some of the main health-related challenges that you are facing in India, specifically at your sites? I mean, I know you have a lot of employees there, and it's a big country. So what are some of the challenges that you're facing, and then are they very different, let's say, from the United States, or are they similar? Just to give a quick snapshot of that would be very interesting, I think.
Thanks, I think that's a great question. In fact, this really is the basis of designing the health promotion program. So addressing your question, the challenges that we face in India and also the challenges that we face in the United States, and purely I'm talking about the health risks or the lifestyle risk. The lifestyle risk front, it is more or less the same, mainly sedentary habits, that's the physical inactivity, unhealthy eating habits, and of course stress. These are at the lifestyle risk level. But when it comes to other health risks, the challenges are quite different. In the sense, India is now having a combination of both infectious diseases as well as the non-communicable diseases. On one side, infectious diseases like tuberculosis, MDR, there's a multi-drug resistant tuberculosis, these are all on the rise. On the other side, people are getting more and more urbanized, more and more sedentary, they're more prone for non-communicable diseases, coronary heart diseases, high cholesterol, high body mass index. So India is really facing this unique situation of both infectious and the non-infectious. And the other important thing specific to India growth market is that road traffic accidents really form a bulk of issues, not directly a health concern, but definitely impacts health. And when we do a cross-sectional study of claims analysis across different Indian corporates, if you take the major Indian, the top 5 or the top 10 Indian major corporates and analyze the claims, road traffic accidents would be in the top 3 in most of them, or at least in the top 5 in all of them. And so this is another unique scenario where driving safety or health promotion driving safety will play a role in India. And the other important thing is maternity. C-sections are on the rise, and due to various reasons, it can be due to medical or non-medical reasons, elective C-sections or the emergency ones, but definitely C-sections are on the rise, and there needs to be a lot of education done around C-section. Now, as compared to the West, like the United States, where infections may not be all the prevalent except for spouts of the flu or other specific pandemics or epidemics, there it's more of the sedentary lifestyle and unhealthy habits that is more prevalent there. India is now facing this huge challenge of tackling road traffic accidents, maternity issues, infections, and non-communicable diseases, and that's a big difference.
Yeah, that's a great point. I think those of you familiar with the WHO data know that road traffic injuries, accidents are very high in certain countries, and number one even in the younger age group. So that's a big burden on anybody, on the system, on employers, and of course the employees themselves. So yeah, great example there. Okay, well I think we should have some questions. Let me open it up. Heather, could you read them out, please?
Sure. The first question: what is the average financial investment of IBM on health promotion activities annually?
Yeah, good question, but this definitely depends it varies from country to country because it would be a combination of investments from global, from local, from business. It may be tough to give one single number, and but definitely I would say when we take it as a benchmarking with other corporates, we are very much comparable and doing a decent job.
The next question, what role do buildings have in contributing to improvements in health?
I'm sorry, I didn't get the question. Could you kindly repeat that?
Yes, what role do buildings have in contributing to improvements in health?
Oh, yeah. There is, also again, it depends on how we analyze it. It could be from contributing towards the innovations in health, contributing towards the healthcare system, and that definitely varies, and it's difficult to say in one word. But definitely that's a separate discussion that we could have.
I think, maybe if I can chime in, I think the question is around the environment, like the physical work environment and how that could contribute to ill health or good health in terms of the actual office building. I think that's what's meant.
Yeah, great question. I got that. So once again, physical work environment is it could play two roles, as I said earlier. One, it could be in prevention of workplace infections, or two, it could also be in effective managing the IBM workplaces, even when there is an outbreak of an epidemic or a pandemic. And in terms of the various exact measures that we would have really taken, if we can just go back to our slide 9, there are a whole lot of physical work environment topics there under safety pillar. It could be around office and general workplace infection preventions, and including the things like the ergonomics and and also the transportation safety. And most important, we have a whole lot of things around building design and operations and fire and life safety, wherein topics like ventilation, noise, the light, and other things are taken care of, including indoor air quality. So it's a combination of multiple factors. I think it may be difficult to summarize in a short time, but just to quickly say, it could be a combination of both prevention of workplace infections and maintenance of a very good healthy workplace, and also managing crisis situations in an endemic and pandemic. Definitely these physical work environment factors have played a critical role. Hello?
Yes, Heather, is there another question? Okay, well then let me ask another one. Could you provide a little more detail, maybe, Balaji, in the time we have, of course, around how do you achieve that the programs have some kind of global standardization? I mean, you mentioned your efforts, and with your team, that's very involved process and logical process, I think. For example, to make it to illustrate it, how about like the HRA, Health Risk Assessment, or the EAP program? Is that required for all sites globally to have that, to offer that? And maybe along those lines, if you could explain that.
Yeah, sure. Thanks. Well, that's a great question. So there are two components to this. One is how do we achieve standardization, and the two, is it required across? So addressing the first one, how do we achieve standardization? So standardization we do achieve in terms of creating a global database or global metrics, wherein we need to know what are all the things that need to be in this program, and what are the key outputs expected from these programs. And definitely we've taken some of the local inputs to ensure that these get circulated across different teams. And the other part of it, are these required across the globe? The effort is to really get them across the globe, and especially in countries where we don't have the priority to get them. But at the same time, it is possible that many of the countries may have their own health risk assessment or their own local EAPs. Then the best thing would be to match that against the existing global programs and see if there are any gaps and how do we address the gaps. So it could be a combination of deploying these global programs as well as addressing the existing gaps across different countries to help them match the global standards and needs through which we are trusted.
Okay. Now, but just to clarify, the goal is to offer, like, for example, the you mentioned the wellness advisor, then HRA and EAP to all sites eventually, right?
Yeah, the eventual goal is to ensure that all IBMers have access to health risk assessment or EAP. Yeah, that's right.
Okay, good, yeah, excellent. Heather, are you there?
Yes, we have a few more that have just come in. One says, I'm very interested in your teaming approach. Can you give us a brief overview of how the teams and the local regional leads are identified and mobilized to drive health promotion decisions?
Yeah, great question. So we already have a lot of people working in health promotion across different countries, and not all these people are medical professionals or paramedical professionals or even health promotion specialists. In some countries, we do have human resource of the HR people driving health promotions. In some countries, we have health promotion specialists training them. In some countries, we have even doctors and paramedics training health promotion. So we do have a whole lot of people, or it's a diverse group which really drives health promotions locally across different countries. So these people, whoever drive the health promotion across different countries, they are identified to support health promotion either locally or regionally. And wherever there are gaps or wherever they need more help to really bridge their skills or even technical capabilities, the regional leads would be able to provide that. And the regional leads are usually those working across continents like Asia Pacific or EMEA or Americas. Can help the local leads wherever specific support is needed, or wherever there's a gap in terms of technical understanding of health promotion, or wherever the non-health promotion specialists are driving health promotion in a few countries. So it's more of teaming and collaboration with multiple stakeholders. And equally important as a part of the stakeholder is the business. Many times even business leaders and business managers do want to run a lot of health promotion programs, but they really not have the expertise in running health promotion. Definitely we take their inputs as a part of the design, and when it comes to operationalizing it, the local health promotion people who have the expertise in that would help in operationalizing in that. So it's a combination of multiple different factors across different diverse groups of stakeholders who really form a part of the students' process.
All right, the next question, can you give examples of specific health promotion measures that were designed to increase physical activity or reduce stress in everyday work life?
Great. First part, increased physical activity. One of the latest examples that I can give you is the biomonitoring device called Fitbit. Fitbit is a device which can be worn around the wrist. It's a small biomonitoring device which can track the number of steps that we take daily. It can track sleep. It can track a whole lot of activities. We can log into that. And we designed a small competition around that, a gamification process. We labeled it as IHS in Motion, that is Integrated Health Services in Motion, wherein employees were encouraged to take part in this competition across different teams. We had the competitions like for teams like Asia Pacific team versus EMEA team versus Americas team versus the global team. There were 4 broad teams, and employees could choose in the team for which they are working. And the number of steps get added up, and they can be tracked on an online dashboard. Employees we have access to this online dashboard, and we can also invite friends into our dashboard, and we can start comparing the number of steps, and it really motivates people to really put in more steps. There are some small mementos or incentives for the team doing the best at the end of a 4-week challenge or an 8-week challenge. The initial step was to get at least around 6,500 steps per day, and the first 4 weeks. And now in the next 4 weeks, we're aiming at to get 10,000 steps per day. So every participant is expected to get at least 10,000 steps per day, and that's really a good motivator. And generally, we believe, we all know that anything which is done continuously for a period of 21 to 28 days becomes a habit. So if we are able to really sustain this habit of getting 10,000 steps a day for 4 weeks, it should become a long-term habit. That's one of the basis for IHS in Motion program. that really addresses the physical activity part. The other part of the question was around any example of program around stress management. So Wellness Advisor, as I mentioned in the earlier slide, is an excellent program for and not just managing stress, but for destigmatizing stress by incorporating that with a whole lot of integrated programs like the medical lines and the wellness coaching, so that it is really attended to. These are top 2 examples I could give on physical activity and stress.
The next question, how do you overcome the manager-employee relationship challenges in terms of work demands versus the ability to control issues in the Indian subcontinent in a region where things are taken personally?
Great question. So the question is very specific to Indian subcontinent. Yes, definitely. I do understand the challenges, the workload balance, and the relationships between the manager and the employees. So there could be multiple different ways of really managing this. The first and the foremost, as I said earlier, was the manager education program. This manager education program really aims in helping the manager understand not just from his or her point of view, but putting themselves into the employee's shoes and trying to understand their perspective as well. They have a whole lot of innovative communication materials. We popularly call them as the mail cast and the mail buzz. The mail cast is basically a small 5-minute animated video presentation to which managers can really help learn identifying employee aspects of managing stress. The mail buzz is basically IBM innovation, where it's more like an online newspaper, wherein the managers can just flip through the different pages where they can get important resources related to stress. They can understand what are the common causes of stress among employees. So these are some of the educational materials. But in addition to these educational materials, one important way that we really think is looking at the HR. HR forms a real link between the manager and the employees. So getting the HR partners involved in this training is one of the basic things. And we believe that when the HR partners are trained in really identifying early conflicts between the manager and employee, or identifying relationship issues between the manager and employee, or identifying the workload balance, they would be in a better position because they have a direct link both upwards towards the managers and downwards to the employees. And this link is very critical. So HR partners training on the stress management, work-life balance is very important. In addition, we have a whole lot of teams, diversity teams, working on various programs around work-life balance, around flexible working, around manager education for flexible working, around manager education for diversity programs, through which they can really address the manager-employee issues. And also we have the case management. That's actually the last step. We don't want that to be the first one, because the preventive measures should be the first one. The case management is the last, when there's already an issue, and that would go to the case manager to settle it within the purview of IBM policies. There's a whole lot of these preventive approaches, promoting approaches, and the last one that is the case management, to which we can really resolve most of these.
All right, and the last question that has been submitted: how do you manage engaging leaders in different geographic regions? Is there a central wellness team that manages everything, or are your programs run more locally?
Great question. I feel when it comes to running the programs or operationalizing the programs, local teams really need to take the responsibility. However, the design can be done centrally in support with the local team's inputs. So it's a combination of central design with local team inputs, with local operationalization of the design, which really works well. Because essentially, if the global team is trying to run a program locally in the country, there would be a whole lot of challenges. They do not know the on-ground realities. So the local teams would be best suited to really refine the programs with the global design. And addressing the question related to engaging leaders, definitely we equip and empower our local leads with all the information and the materials needed for them to take it to the leaders locally. And if required, even we could partner with them to take it to the leaders. And so it's a combination of all these, with the central design and the local operationalization that works.
Wolf, those are the last of the questions that have been submitted.
Yeah, no, great. Thank you, Dr. Balaji. That was very, very useful and enlightening, and great questions, by the way. So thank you to the audience. That's exactly what we envision, and that's why we always have a considerable, significant amount of time for questions with the presentation time as well. So thanks again. So I'd like to encourage you, if you feel, you want to apply to the awards, I put up the slide again to see the website in the bottom. That's where you can get all the information. You can also contact us through that website if you have any questions, or maybe even have questions for Dr. Balaji. I should also mention that in terms of attending the Global Summit, the Awards Summit, which is not just quote-unquote just the finalists, it's also a conference in total. There's an early bird registration until the 19th of December. I just wanted to mention that for those of you who are interested. It's in Brazil, in a beautiful place called Florianópolis. I should mention that the webinar the recording will be available in a few days, and also through our website as well as the IAWHP website, so you can access that. And in case some of your colleagues or you wanted to replay something, that's another opportunity. So I think we're pretty much done. Again, I'd like to thank you, Dr. Balaji, for presenting. I know it's nighttime or evening time, late evening time for you. It's been great, and thank you everybody for attending. And keep posted for additional information and webinars from the Global Center for Healthy Workplaces and IAWHP. Thank you very much for attending again, and have a great day. Bye-bye.
Thanks.
Thanks.